First, I would like to ask for your both permission to use this interview for educational purpose and on internet.
Yes, you have our permission.
Sure.
Excellent. Now, tell me, how long have you had symptoms before the surgery?
Oh, for years.
1 to 10, how bad was the pain?
Oh, it was very bad.
10, 8, 9?
8 for sure.
For sure. And we maximized the conservative therapy, and then we did the imaging and so on. And I'm just going to turn back and look at your picture here that shows you had quite significant disc disease and a segmental, what we call scoliosis. We measured that. It was around 16 degree. We did the surgery just about a month ago, and we corrected, and now the Cobb angle, we call it, is about 5 degree. As you see, bone is touching the bone here, and here is separated. So you're actually probably a good part of half an inch or so, or even more taller now, with that the height that we restored. Let's talk about the surgery. Surgery just was about a month ago, right?
Yes,
How long after the surgery did you walk?
the next day.
The next day. And how long did you stay in the hospital?
2 days.
Just 2 nights, yeah. And after you were discharged and right after the surgery, how was the leg pain?
The leg pain was almost gone.
Almost gone. And then how were you doing just in the weeks or so after the surgery? How was your pain? How was the ambulation and so on? Tell me about that.
It was very good. I still have weakness in my leg from the pinched nerve. Going upstairs is a little difficult. But I was doing very well after now this month. Before I fell,
Yeah, you
I
fell
was,
about a week ago, or when did you fall?
no, days ago. It was
2, 3 days
Wednesday,
ago.
2 days ago.
And some of the pain came back after you fell, obviously.
Yes, it did. But
It did-
I don't know if it came from my back, though.
Yeah.
I'm not sure.
Well, I think if we looked at the CAT scan, no damage is done. It's obviously going to be a setback, but I'm expecting you in the next few days or weeks, catch up, and some physical therapy will help with that. So far, I think I'm happy with the improvement I see, and I think that fall is a minor bump on the road. But I like as well to talk about you, because you told me you had a surgery as well. Why don't you tell me about your experience?
I had the surgery in 2005.
An open surgery.
Open surgery, yes.
Almost same number of the levels.
Yeah.
Yes,
right.
exactly same
I
number
had
of the
the
levels.
rods and pins,
Okay.
and I was in the hospital, I think, 5 days, and I would say it took me 10 days before I could comfortably walk a couple hundred yards.
Okay.
I was a piece of toast.
Yeah. Now, how long after? So 10 days to walk. How long did you stay in the hospital?
I believe it was 5 days.
5 days. And how long after the surgery could you go back to your basic daily activity?
3 months.
3 months.
I would say 2 to 2.5, 3 months.
How long did it take you to go to your basic previous life?
Oh,
Not long.
a week.
Not long.
A
A week. Now,
She went back to work in 2 weeks, which
Yeah.
I didn't agree with, but
and you told me something else about that you being about her improvement when you compared the two.
well, when I seen how fast she recovered or recouped, maybe jealous.
Yeah, and you told her that, right? So this is a record from my. We very clearly, very meticulously, we gather our data. Your surgery was actually. We had only 38 cc of blood loss, and our operation time was just 56 minutes. That's all it took us to do your surgery. Tell me about your surgery. How long did your surgery take?
I believe it was about 7.5 hours.
7.5 hours.
And
Yeah.
I remember I had it on a Friday, and Sunday I needed a blood transfusion.
Blood transfusion,
which
because still the
did not
drains
agree
are
with me,
here.
but yeah.
So you're saying we did almost same surgery. It took us 56 minutes, and we lost like about 2 ounces of blood, maybe actually less than 2 ounces of blood, 38 cc. And I cannot take all the credit for that. Yes, I obviously know we did it together and so on. I think it's a different technology, different method. The OLLIF which is with the smaller incision versus the open surgery, which we literally fillet your back open to just get in. So it is mostly the technique that makes the huge difference. And I think you can feel it on yourself, and you can just compare it, because one of you got the open one and one the old the new one. You know, if you would have the choice to go through the same surgery, would you ever go through the other surgery?
No.
No, you wouldn't.
I felt she needed surgery for the last year or so, or a year and a half, and I truthfully was trying to talk her out of it.
Okay. How do you feel about it now?
Because I went through, and I'm glad she had it.
Yeah. Thank you for the interview. I really appreciate that.